to everyone. Good evening, all. I welcome you all to this very important session of Telangana Janavedika, when the whole world and the humanity is reeling under a lot of human threat. Telangana Janavedika has decided to enlighten all its members and the public in general about the impending danger of the pandemic COVID-19. For this, we have requested Dr. Abdul Khabeer. He is one of the eminent doctors and practicing is a medical ENT specialist. He's done a lot of things for his credit. So for this, I request our member and associate, Dr. James Prashant, to introduce Dr. Khabeer and also to do the rituals of Telangana Janavedika. Thank you so much. James, please take it.
Good evening. I welcome everyone this evening for this 426th session of Telangana Janavedika's forum. Our topic today is COVID-19 third wave, myths and realities. To live up to the expectations of the forum, Telangana Janavedika has been regularly conducting sessions on COVID-19 by bringing in eminent doctors to speak on the subject. And this is the 5th session on COVID. It has been 2 years since this COVID-19 virus has been devastating. Am I audible? Can you hear me, please?
Yeah, you are audible.
So it has been 2 years since the SARS-CoV-19 virus has been devastating to the global human population. Since then, we had severe disruption to our general life. The health sector especially took the brunt of the pandemic, with doctors and related medical personnel working in the most daunting circumstances, putting their lives on risk to treat and save patients. Education sector has been also severely affected, with students, especially from weaker economic backgrounds, losing out. Commerce in all sections of the economy took a hit, affecting employment, leaving many without jobs. Our country took a devastating hit last year in the second wave, and many of us lost someone known to us. Now, the third wave of the SARS-CoV virus has hit us, which is named as Omicron. This variant is spreading widely and infecting large numbers of people, including the vaccinated and those previously infected with the virus. We are reading that the record number of cases reported globally is because Omicron is more contagious than previous variants and has a greater ability to evade immunity to infection. At the same time, early evidence indicates that it is less common for people infected with Omicron to experience very severe disease and getting hospitalized. It seems that Omicron is much different to other variants. It seems to be milder, and that the vaccines we are taking are working, which is important. But it is spreading fast, very fast. And this again seems to have the potential to disrupt our lives again. These disruptions are leaving the people frustrated. the basic elements of what we understand about the virus seem to have shifted again. And we have many questions like the period of isolation, medical protocol, the reason for the speed of the Omicron infection, and about future variants and how will they behave. The testing process and protocols are the same as for the earlier variants. And epidemiologists generally assess the spread of virus through mathematical modeling and projection using computer-based representation. And how far do these work? Were they able to predict the fastness of the Omicron? And to answer all this and to speak with us this evening and to answer all our questions on this very, very important topic, we are extremely happy to have Dr. Ahmed Abdul Khabeer with us. Dr. Khabeer is an assistant professor, ENT, H&NS, Government Gandhi Medical College, Hyderabad. And he has worked as assistant professor and gained wide experience in dealing with all sorts of emergencies and non-emergencies. Being faculty in Gandhi Medical College, has gained experience in teaching MBBS undergraduates and MSDLO postgraduates. Had a privilege of being external examiner to various colleges across India for MBBS and MS exams. Worked as a prestigious Amrita Institute of Medical Sciences, Cochin, in the Department of Head and Neck Surgical Oncology and Plastic Reconstructive Surgery. He has worked at Basavatarkam Indo-American Cancer and Research Center, Hyderabad. And he has worked previously at many other places. And he is his education qualifications are MBBS, JJM Medical College, Devanagar, MSENT, H&NS, Rangarai Medical College, Kakinada. Has a fellowship, advanced micro ear surgery, fellowship in head and neck surgery and oncology, USA, diploma, world skull base. And he has many academic achievements like securing highest marks in pathology, forensic medicine, community medicine, top university and final MBBS exam, secured highest marks in Andhra Pradesh state in MSENT, H and NS exam, achieved GSV Prasad Travel Fellowship Award in micro ear surgery. And he has many areas of expertise like advanced micro ear surgery, cochlear implant surgery, endoscopic sinus surgery, skull-based surgery, head and neck surgical oncology, microlaryngeal surgery, facial plastic surgery, stepidotomy, cochlear implant surgery, reconstruction, PINA, has many expertise in rhinology, head and neck surgical oncology, microlaryngeal surgeries, facial plastic surgeries, extra. He has many papers presented, and also he has presented, he has published many papers in prestigious medical journals. We are especially very happy to have an eminent doctor and also established academician to be among us, with us, to speak with us, and to answer our many questions and to enlighten us. We are happy that we have Dr. Khabeer here. And before I hand over the floor to our moderator, as per our tradition at Telangana Janavedika, I would like to read the preamble of our constitution. We, the people of India, having solemnly resolved to constitute India into a sovereign, socialist, secular, democratic republic, and to secure to all its citizens justice, social, economic, and political, liberty of thought, expression, belief, faith, and worship, equality of status and of opportunity, and to promote among them all fraternity, assuring the dignity of the individual and the unity and integrity of the nation. In our Constituent Assembly, this 26th day of November 1949, do hereby adopt, enact, and give to ourselves this Constitution. Now, I would like to hand over the floor to the moderator. Thank you.
Thank you, James. May I now request Dr. Khabeer to take over and enlighten us, please. And I will share this screen for you to give a PPT presentation, Doctor. Thank you. Dr. Khabeer?
Yes, sir.
Yeah.
Good evening, everybody. I'm very much privileged to be amongst you all today. And I would like to, at the outset, thank all the organizers who have given me this opportunity to share my knowledge, which would help us all to keep ourselves safe from this virus, that is COVID virus and its new variant, Omicron virus. So, let me give some introduction, but this topic as such doesn't require any introduction because we have already been reading, hearing, and discussing about this COVID virus for past 2 years. We have seen how it has caused wave 1, wave 2, and this is the third wave which we are right now witnessing. Coming to some of the brief thing, origin of COVID-19 virus. This belongs to coronavirus category. Corona means crown because this virus has got some spikes on its surface, which gives an appearance of a crown. This has got a specific name of coronavirus. So this is the virus belonging to that family of coronavirus. And this further underwent mutation and resulted into a novel coronavirus, which is COVID-19. This was first seen in Wuhan of China, caused a pandemic, and it caused waves, first, second, and the third, which we are right now witnessing. Coming to some of the details or some brief about the first wave, it was by the COVID-19 or novel coronavirus was the causative organism. And the symptoms with which it presented were fever, cold, cough, loss of smell, loss of taste, followed by respiratory distress, pneumonia, and so on. If you see that the first wave, the symptom complex included loss of smell and taste. And
The screen sharing has been done.
We lost Dr. Khabeer. You may rejoin. I think there's some problem. Yeah.
Yes.
Doctor, you have to unmute yourself again, please. Yeah.
yes, sir, I have unmuted me and unmuted. And if this case, if it is not promptly diagnosed or treated at right time, it would lead to respiratory failure and death of the individual. So this is something about the first wave. And coming to second wave, these are the salient features. It was the Delta variant of this COVID-19, which was mainly responsible for this second wave. The presenting symptoms were slightly different. The cold, cough, and some GI symptoms are further added to it. Diarrhea and multi-organ involvement, like involvement of lungs, kidneys, pancreas, and so on. So first wave, it was mainly of respiratory disease. COVID was supposed to be a pulmonary problem, which was affecting lungs directly and finally resulting into lung failure and death. But in second wave, because of the mutations and the changes, the Delta variant has become much more deadly. This started involving not only lungs, but affecting kidneys, pancreas. This derailed glycemic control or the diabetic control was disturbed in individuals. And this also led to involvement of kidney. So multi-organ involvement that made it a very extensive and a systemic disease. One more thing which is worth mentioning is about the black fungus epidemic that was seen in second wave. This was the fungus which has which was seen in many patients, especially in India. It was said that the number of cases were so high that it was labeled as an epidemic. The huge number of black fungus cases were noted, and within a very short time, it will cause disease in the nose, sinuses, eye, and brain. These are all the vital parts of the face of an individual. It starts with some nasal discharge, blood stain, pain in the face or the facial pain, orbital pain, and suppose if it is not properly diagnosed and treated, it has got a very high mortality rate. In case if it involves brain, then the mortality is as high as 80%. And in case if it involves eye, then the mortality would be somewhere around 50%, which is also very high. So it was one of the challenges which India has faced during the second wave. Coming to the third wave, it is the Omicron, which is the cause of this third wave right now. The presenting symptoms are a bit different. The main presenting symptoms are scratchy throat, weakness, severe muscle pains and night sweats, cough, and other systemic symptoms. So here, again, because of the change or the mutation in the virus, the presenting symptoms are a bit different from those of the classical COVID-19 disease. It is not, if it is not treated promptly, would lead to systemic involvement again and would even be a cause of death. Now, let us try to understand what is the reason for this variation. It is because of mutations. What is mutation then? It is a scientific term, no doubt, but there is in mutation is nothing but a genetic sequence change of virus. This is an adaptive process in viruses. Whenever virus sees that there is immunity in individuals or resistance developed to its disease-causing ability, then it adapts to the different environment. It changes its form. It changes its antigenic structure. It changes its transmissibility, virulence, resistance to medicines and vaccines, and thereby it will come and attack once again in a fresh way. That is nothing but mutations. So these mutations bring change in virus. It becomes revived. It gets a fresh form. It gets an opportunity to attack human beings once again in a different form. That is what is mutations. So this COVID-19, at first it was coronavirus, which got mutated and resulted in a novel coronavirus, which is nothing but COVID-19. Then COVID-19 underwent mutations, and that resulted in Omicron variant of South Africa. And there is one more mutation, which has given it the form of a Delta virus. And now the latest mutant variant, which is seen, is COVID-19 with 46 mutations or changes in 46 different places of its DNA. And that is named as IHU variant in France. So that is the latest mutant variant. So this is a regular feature of all the viruses, and likewise, corona also undergoes mutations. Let us now just have a look at medicines or the medications that are usually given to treat COVID-19, because this is all the platform of all educated people. I think I can mention the names of all these medicines, and I hope that most of the people might have heard of these names. And I think none of these medicines would be a new name for every one of us. But just for an information, initially HCQ or hydroxychloroquine, an anti-malarial drug, was supposed to be effective and was used for treatment of COVID-19. Then came ivermectin. It's an anti-helminthic drug. It was said that it is effective, so it was used for some time. Then the antibiotics that were supposed to be beneficial were azithromycin for its immunomodulatory effect. And then antivirals like favipiravir, remdesivir, molnupiravir, and nirmatrelvir, these are some of the antiviral drugs which are used for COVID-19 treatment. Favipiravir is a broad-spectrum antiviral drug. Remdesivir was the first drug which was said to be effective against COVID-19. It is the drug which is most widely used for treatment of COVID-19 all over the world. It was so much used that at times there was scarcity of this drug. And so far, I think this is the only drug which was used most widely in saving lives of many people during wave 1 and wave 2. Now we have the latest molnupiravir, which is set to bring down the viral count to 0 within 3 days. No doubt, it is a groundbreaking reality and a good breakthrough in the treatment of COVID-19, but this also has got some shortcomings. The shortcoming is it cannot deal or treat the patients who are already in severe form of the disease. This is very helpful in initial stages before the virus could set in or establish itself in different systems of the human being. There are certain drugs which are used other than antivirals were steroids. Steroids like prednisolone, dexamethasone, methylprednisolone. These are some of the drugs which were used to reduce pulmonary edema, increase oxygen saturations, and fight against COVID-19. IL-6 receptor blockers like tocilizumab, sarilumab are some of the drugs which help in blocking IL-6 receptors. IL-6 receptors are responsible for the cytokine storms. They are responsible for pulmonary edema, and they are responsible for the fall of oxygen saturations in individuals. So IL-6 receptor blockers were also very much helpful in treating patients with COVID-19. Now the latest entry is of monoclonal antibodies. Monoclonal antibodies are said to be one of the very good tool to deal with COVID-19 patients, and casirivimab are some of the monoclonal antibodies. No doubt, these monoclonal antibodies are very effective, but at the same time, very costly, and affordability would become a challenge for the people who are suffering from COVID-19. Additional supportive care with oxygen, non-invasive ventilation, ventilatory support are some of the other methods how the patients suffering from COVID-19 are treated. Now coming to Omicron, the latest sensation in the society, not just in India, but in entire world. This is talked about in international media, all scientific forums, WHO. this has bothered every one of us. And we know not much about this, but we are still studying and trying to understand what Omicron is. It's nothing but a variant of COVID-19, and it is due to multiple mutations that this has come into existence. This is labeled as B1.1.529 by the scientists. It was first identified in South Africa on November 24, 2021. It is known for its high transmissibility. Incubation period is less than 3 days against 5.2 to 6 days for COVID-19 virus. This is said to be milder. This is said to cause milder disease. Symptoms are said to be mild. Duration is said to be less. Hospitalization is said to be less. And it is said that less requirement of higher medication and less would be death rate. These are some of the things which are anticipated or predicted so far. But this is still not confirmed. This is just a myth, but the studies are underway. There are lots and lots of racial and geographic differences between the individuals of different countries. The people of South Africa are different genetically, they are different racially, they have certain differences, and that difference will definitely be of an advantage for the virus. Virus might hit hard in some parts of the world, and we can equally be affected by this virus. So we need to be cautious. And this is the very reason why we are all discussing about Omicron, why we are trying to educate each other and trying to be safe from this virus. Basically depends, and basically the severity of the disease depends on the individual immunity and the other comorbidities of the individual. So an individual is the most responsible person when it comes to preventing or keeping himself safe. He cannot depend on herd immunity. He cannot say the people in South Africa didn't have a severe form of the disease, but he has to take care of himself, because the individual immunity plays the most significant and vital role in preventing himself from the disease. Now coming to some of the myths and facts, myths and realities about Omicron. Let us come to first one. Omicron causes less severe disease is one of the myth, and it is so much discussed in media that it is like accepted by most of the people. Whenever the word Omicron comes, people say it's a less severe disease. This is a milder illness, and probably we will get on, or we will get through this even if affected. So this has given us false confidence, or we have become somewhat overconfident. We have taken it granted, but this should not be our attitude. Studies are underway. Racial and geographic differences exist. Basically, our immunity and comorbidities are one which decide how severely we can get affected. And at the same time, let me tell one fact, that in spite of all these, we are seeing severe form of disease in other parts. In US, the hospitalization rate is more than 10%. Means to say that out of 100 individuals affected, there are more than 10 individuals hospitalized. This is
Doctor, we lost you. Hello? Hello? Dr. Khabeer? Hello?
His mic is on, sir. Doctor's mic is on.
Yeah. No, we lost him now. I think he will rejoin, probably.
Rejoin.
Yeah.
So maybe you should call him.
I'm calling him. Sorry for the disturbance. Dr. Khabeer, there's a power outage there. He's joining again in a few seconds. Please bear with us.
The number you have dialed is currently busy. Please try later. మీరు డయల్ చేస్తున్న నంబర్ ప్రస్తుతం
Join Sanitizers, sir. Welcome back, doctor. Please unmute yourself and continue your talk, sir.
First myth which we have discussed, it was about Omicron causing less severe disease. The second myth is anyone who has already suffered from COVID virus previously will not get affected by the virus again. Omicron is ineffective against such individuals. This is again a myth. There are cases who previously suffered from COVID and got affected with Omicron again. Reinfections are very much possible. So we need to be cautious. Third myth is about anyone who got vaccinated will not get Omicron. Vaccinated persons are getting affected with Omicron. World's highest number of cases were recorded in USA, where the vaccination is also highest. It is up to 78%. This shows that the vaccination is not effective in preventing its spread, but definitely it is. It can prevent the serious form of the disease. There is one more myth which says vaccinations are not at all effective, and there is no use of vaccinations are not. People might get infected, but definitely it is effective in preventing serious forms of the disease, because a person is at least insured from serious disease, so he can or he has to get vaccinated soon. And in case if he is vaccinated, he has to consider and take a booster dose. Myth number 5, currently available tests like RT-PCR and RAT are not sufficient to diagnose Omicron. RT-PCR and rapid antigen test still remain gold standard tests for the diagnosis of Omicron. There are other tests which help in studying the genetic nature of viruses, which say whether it is COVID or Delta or Omicron. But basically, for any variant of COVID-19, it is RT-PCR and RAT tests which are effective. So these still stand correct tests for diagnosis of COVID-19. Then there is a myth, that is the 6th one. Effectiveness of current treatments is questionable. There are people who are worried. They feel that the treatment and all the tools to treat COVID-19 have just become ineffective because of this mutations in this virus. No, COVID needs symptomatic and supportive care. Steroids and IL-6 receptor blockers are still effective against all the strains of COVID-19. Then, myth 7, Omicron or the third wave will affect children the most. There are ongoing studies which show that there is no change in the incidence of COVID-19 in children. Number of children affected by Omicron is similar to the number affected by Delta and COVID-19 during first and second waves. So we need not be afraid about this, and this is a myth, and the reality is that there is no special affection or predilection for the virus in the third wave for children. Now coming to the precautions that we are supposed to take. First thing is the mask. Mask remains the best way or the best tool to keep oneself safe. Mask should be a good one. It should be worn properly, covering nose and mouth. There should not be any leak of air and should be worn continuously without taking it out even for a while. This is very important. There are people who take off mask for a while and then keep wearing it again. So the protection that a mask gives will not be complete if it is removed on and off. And let me give an example of Dr. Fahim Yunus, who is a renowned awarded physician in USA. He entered COVID ICU for more than 2,000 times to treat COVID patients during during wave 1 and wave 2. And every time he entered ICU, he wore a proper mask and he was safe. He protected himself from COVID. He didn't get affected during first and second waves. And recently he says he has attended a family function for 2 days without a mask and got affected with COVID. He says mask really works and it is a wonder tool to prevent or keep oneself safe. Second point is social distancing. Second point is the social distancing. Social distancing is an important measure again. We need to maintain distance so that the virus doesn't reach other people even if someone is affected. This will break the transmission from one individual to the other. The third one is hand washing and use of sanitizers. Even if we touch anything, even if we touch fomites, even if we touch some infective material by any chance, while taking care of patients or other people at our home, then we have to keep washing our hands to get rid of these viruses. This is again very important. And avoid gatherings and closed or crowded places. This is one thing which is, I feel, is ignored in our country. We do may take a mask, we do use hand washing and sanitizer. We also observe social distancing, but one thing which we are not very serious about is about the gathering in closed chambers, gatherings or going to crowded places. These are the things which will prove to be super spreaders. That is the reason we have to keep ourselves away from gatherings, closed chambers, and crowded places. Last but not the least, vaccination, vaccination. Even if it is not 100% effective in preventing transmission, it is definitely effective, proved beyond doubt, that vaccination prevents a serious form of disease. Therefore, we have to get vaccinated at the earliest. We shouldn't ignore this point. And if we have taken both the doses, then we have to consider taking a booster dose to keep ourselves safe. Coming to some of the future perspectives. Perspective number one, COVID-19 getting mutated to Delta, Omicron, and IH2 variants. Of this, Omicron variant spreads faster, affects people very fast, causes milder disease, and people acquire resistance or immunity against this virus. Finally, the virus will not cause pandemic because most of the people have anyhow acquired resistance or immunity against it. So the pandemic might come to an end. This would be a very big blessing from our Almighty. But there is other possibility as well. There is other perspective which can also happen. COVID-19, it has got mutated to Omicron variant, which has a faster and a high transmissibility. This spreads very fast, and this spreading very fast can also enable virus to undergo mutations faster. More mutants might come in future, and more waves or impending dangers might be seen in future. So this is the other dark aspect of COVID-19 pandemic. We have to just wait and watch. There are many studies, surveys, and many research going on in this perspective. Let us hope that something good happens for us. In any situation, virus will remain in air and keep affecting individuals like any other disease. If it may not cause pandemics, and taking precautions and staying safe is very important. So even if it doesn't cause pandemics, it will not completely get eliminated from the society. It will still remain. So in such situations, we have to take all the care and keep ourselves safe from the Omicron or other variants of COVID-19. These are some of the things which I thought I can share with all of us. And thank you for a very patient listening.
Thank you, Doctor. And I will now hand over the mic to this moderator, Dr. Akutota Srinivasulu, who joined us late today because of some personal work. Later, he will open the floor for questions. And anybody is having any question, please raise your hand. I will unmute you so that you can ask your questions to the doctor. Thank you so much.
Thank you, sir. Thank you. Dr. Khabeer Ahmed garu sumarga COVID మూడో దశ భ్రమలు వాస్తవాలు అనేటువంటి అంశం మీద సుమారుగా 30 నిమిషాల సమయం పాటు వారు అనేక విషయాలు చాలా స్పష్టంగా చెప్పారు. ముఖ్యంగా COVID-19 అండ్ డెల్టా ఒమైక్రాన్ సంబంధించినటువంటి విషయాలను చెప్తూనే ఈ యొక్క ఒమైక్రాన్కు సంబంధించి 24th 2021లో సౌత్ ఆఫ్రికాలో దీన్ని కనుగొనడం అనేటువంటి జరిగింది. దీని ట్రాన్స్మిషన్ అనేటువంటి వెరీ స్పీడ్గా ఉంటుంది అనేటువంటి విషయాన్ని చెప్పుకుంటూనే దాని యొక్క ఇన్కంబెన్షన్ పీరియడ్ 3 రోజులుగా వారు చెప్పడం అనేటువంటి జరుగుతూనే దీంట్లో మైట్స్ అండ్ రియాలిటీకి సంబంధించినటువంటి చాలా విషయాలు మనకు తెలియని విషయాలు వారు చెప్పారు. ముఖ్యంగా ఈ యొక్క ఒమైక్రాన్ సంబంధించినటువంటి విషయంలో మాస్క్ అనేటువంటిది కంపల్సరీగా పెట్టుకోవాలని, సోషల్ డిస్టెన్స్ ను పాటించాలనేటువంటిది చెప్తూనే హ్యాండ్ వాష్ అనేటువంటి చేసుకోవాలి, శానిటైజర్ చేసుకోవాలి అనేటువంటి విషయం చెప్తూనే మరొక ప్రధానమైనటువంటి విషయం అవాయిడ్ గ్యాదరింగ్ క్లోజ్డ్ అనేటువంటి విషయాన్ని చెప్తూనే తర్వాత ఈ యొక్క క్రౌడ్ ప్లేసెస్ లో ఉండకూడదు, తప్పకుండా వ్యాక్సినేషన్ దీనికి నివారణ అనేటువంటిది చాలా స్పష్టంగా చెప్పారు. వారికి మా తెలంగాణ జనవేదిక తరఫున ప్రత్యేకమైనటువంటి ధన్యవాదాలు సార్. ఇప్పుడు ఎవరైనా మిత్రులు డాక్టర్ గారిని ఏమైనా మీ యొక్క ప్రశ్నలు కానీ సందేహాలు కానీ ఉంటే అడగగలరు. మీ యొక్క హ్యాండ్ రేజ్ చేయొచ్చు, లేదా డైరెక్ట్ గా మీరు అడగడానికి అవకాశం ఉంది. ప్లీజ్. ఏమైనా మిత్రులు ఉన్నారా? ఏమైనా డౌట్స్ కానీ ఏమైనా క్వశ్చన్స్ కానీ? డాక్టర్ సంజయ్ రెడ్డి గారు, సుధాకర్ గారు.
Thank you very much. At the outset, I thank Dr. Khabeer Saab for excellently presenting the most important disease pandemic which is ongoing for the last about 2.5 years or so. I was actually writing down the important points which Dr. Saab was telling about, and such as the emergence of novel coronavirus, the drug treatments, and additional supportive things that are to be taken up, and the mutation changes that are being occurring. I think we are in third stage, it appears, and precautions that are associated with the controlling of disease, the role of vaccines, and further perspectives, actions that are to be taken up by the patients. But what actually made me to ask Dr. Saab is that it's my personal opinion first. If anybody happened to feel a little bit adverse, then I apologize. See, already the coronavirus has resulted in a very serious impact throughout the globe. But at the same time, the so-called medical mafia appears to have been turned into medical mafia. A general obsession that the result of the first stage coronavirus, as we have seen, that people have not only lost their lives, but the entire, not only savings, but the patients were also supposed to sell out the entire properties, and the cost happened to be running into lakhs of rupees, and there is no guarantee for life. At I have got my own experience in my very new relatives have lost their lives after spending huge amount of money. And I think this has caused by a kind of development of caption that the medical mafia has emerged into the of a medical mafia. Could kindly Khabeer Saab enlighten on this, because the so-called remdesivir or any other medicine, the so-called vaccines or medicine, these are that. I had an opportunity of going through certain international journals as such. They said that there is no hard and fast 100% foolproof treatment at all. Only, as you told, that the so-called masks, this social distancing, and not entering into the mass and all that, that might have already definitely prevented. But whereas on socio-economic impact of this COVID, would you kindly enlighten the people, us, because we are all not, majority of us are all not from medical profession, and the medical profession, as I repeatedly tell, I have no obsession that medical mafia, a certain a small number of hospitals and all that have turned into that a kind of mafia and encashed this disease enormously and without taking any kind of responsibility or in that, and as such there is no assurance for the treatment. That is what is my personal opinion. Would kindly Khabeer Sahib enlighten us? Thank you.
First of all, let me tell you, I respect your feelings and all. It was no doubt a reality. But the thing is, whenever there is a pandemic or an epidemic, one of the important part or the feature, integral point of pandemic is there would be very huge number of cases coming up every day. And in any country, as you take, the medical facilities would be deficient to tackle that good number of or the huge number of cases. So that is one of the point where people try to cash it. One. Secondly, there was this disease was airborne disease. So the spread itself can cause very further increase number of cases in case if the proper measures are not taken, like PPE kits, like proper sanitizers, keeping gloves, keeping a different section where the hospital should be converted, sanitized regularly, and all those measures are itself very costly. So that those measures also costed for the treatment of the patients, and that was an additional tax for them. Because this was a new disease, personnel needed to be trained for it. So that training also added to the cost of the patients. At the same time, whenever there is a serious form of the disease, then the patient should be kept in ICU, where he or she should be monitored regularly, closely have to be watched for symptoms, and all these ICU treatments were a further burden on the patients. No doubt, these all increase the cost of treatment. But, sir, with an apologize, I would like to say that because some of the hospitals have cashed it, we cannot categorically say that every doctor or every medical professional was responsible for it. No, we definitely condemn those people who have cashed it. But at the same time, there were very good number of good Samaritans who have laid their life to save people from this deadly infection. So when there are pros and cons, good and bad, there are some of the things which need to be appreciated, which need to be condemned. When it comes to people selling their properties, I do condemn. I condemn it from my heart. And to some extent, this can be better dealt. In some of the countries, all the healthcare was made free. In our neighboring state, Andhra Pradesh, this was included in Arogyasri, where people didn't have to pay anything much. In our neighboring state, Karnataka, there were strict conditions laid down by government, and anyone violating all the ceiling limits were put for costs, and anyone violating was de-affiliated and their hospital permissions were withdrawn. So these were some of the regulatory measures, and these regulatory measures can be followed even in our state. Though, in spite of all these, I do appreciate and allowed all the measures taken by our own state government. If we see North Indian states, the people who were suffering from COVID had to stay and wait in corridors for hours and hours together. Some of the patients died in queue, but thanks to our state government, I do appreciate all the efforts made by them. They declared the Gandhi Medical College and Hospital as a COVID center, and I'm proud to say that Gandhi Medical College and Hospital has admitted, treated, and discharged largest number of COVID patients in entire country. And it was all the foresight, farsight, and the vision of the people and the state government which has taken all the measures to help people out of this crisis. So anyhow, there will definitely be certain shortcomings. We will definitely consider those things, and let us hope that we will not have to face such hard time in future. I do respect your feelings, sir. Let us help each other and see to it that we are all out of this pandemic.
There's one raised hand. Ahmed, please go ahead, Ahmed.
Yeah, good evening, Dr. Khabeer.
Good evening, sir.
I just wanted to ask one simple question regarding the children. What additional precautions would you suggest for the children who are not vaccinated?
First and foremost is to keep children safe, keep children at home. That is the very reason why the offline education has been converted to online education now. And at the same time, we should keep children away. Suppose if someone is affected, we have to keep that affected person totally isolated. We have to see to it that the children do not come in contact with them. And at the same time, we have to train children with all the safety measures like mask, sanitizer, and so on. We have to avoid taking children to masses and gatherings, closed cabinets, and so on. At the same time, we have to try build up the immunity of children, because there is no artificial means like vaccine available for children so far. We have to try to see that they have good nutrition, good hydration, good rest. So and some of the measures to build up their immunity. It is said that some fruits, fresh vegetables, and antioxidants, multivitamins, calcium, zinc, all these boost up immunity. So we have to try to boost up their immunity and try to see that they are strong enough. Even if they get affected, they do not get into the severe form of the disease. This should be all the measure and attempt we have to make towards the safety of children.
Thank you very much.
Thank you.
Professor Vishnu Chaudhary.
Dr. Vishnu Chaudhary, sir.
Oh, I thank the doctor for a very brilliant. Am I audible?
Yes, sir. Please.
Am I audible?
Yes, sir. Please, sir. Please, go ahead.
I thank our young friend and doctor for a very lucid presentation of things. And this pandemic has created havoc in the whole world, and everyone is scared about this. I want to only ask simple question: is it possible where we have an antigen test, it comes positive, but RT-PCR it is negative on the same patient? How do you feel?
Sir, actually, RT-PCR is more a confirmatory test than a rapid antigen. And none of the tests are 100% specific and sensitive. There are certain shortcomings for each test. That is the reason why we have a battery of tests. Suppose we miss some diagnosis in some particular test, there is an additional complementary test which will help us out to diagnose that patient. So it is very much possible. We are seeing people who are tested negative for RT-PCR but positive for RAT, and negative for RAT and positive in RT-PCR. Anyhow, when whichever test comes positive, we have to label that person as a positive patient. We have to treat him, keep him under isolation, keep his oxygen saturation monitored, keep his blood glucose levels monitored, and try to treat him from that condition. So any of the test is otherwise considered as positive for COVID, and we cannot say that one is superior, the other is inferior. Every test is complementary, and we have so many battery of tests. Apart from that, we have CT, chest, and so on. So at times, if there is a confusing situation, I think one or the other test will at least help us out in coming to the conclusion and diagnosis of the patient.
Thank you. Thank you.
Welcome.
థ్యాంక్ యూ చౌదరి సార్. ఇంకెవరైనా మిత్రులు ప్రశ్నలు? నరసింహులు గారు, నరసింహులు గారు. మనోజ్ రెడ్డి గారు. మనోజ్.
That's up.
Yes, sir.
I have got one small doubt.
Sir.
As far as the third wave is concerned, this Omicron, it appears that the coronavirus protocols appear to have been changed drastically and eased, placed in America, as we frequently, because my children they stay there, almost all are affected. And the protocol says that it is only for 5 days minimum quarantine, and even after that, there is no necessity for going for a COVID negative test as such. So it appears to my mind that this so-called third wave Omicron appears to be not so much dangerous compared with that of a coronavirus original. Would you kindly enlighten us? Because the feelings of people in India also is such that they take it very easily. But according to speech, there is every probable danger that at one or the other juncture, there may be possibility of again converting this into a kind of a pandemic and may result in a drastic manner. So would you kindly enlighten on this thing?
Sir, one thing I would like to highlight is the pandemic. There are a huge number of cases, fresh cases coming every day. The
Yes.
number of incidents would rise to unexpectedly high number of cases. That is a feature of pandemic. So,
Yes.
with such huge number of cases coming every day and day out, the medical facilities would always be deficient. It's would be lesser than what are required. In such situation, probably we might not be able to find beds and hospitalization for all the patients. In such situation, even if it is milder, at times any delay in hospitalization can also turn it into a severe form of the disease. So there are many possibilities that a person might suffer from a severe disease. And as I said, there are many changes, many differences, racial differences, geographic differences, and atmospheric differences, and basically the individual immunity. I have seen people who are very hale and hearty, who look very strong enough physically, and they fall prey to this infection and they get into a very severe form of disease. So, by just considering the physical strength or anything, we cannot gauge how strong his immunity is. So, at the bottom line, I would just like to say there are studies which are still underway, which are calculating the death and mortality rates and how many patients are going into severe form of disease. All that will come to light after some time. But till then, we have to take care of our own selves. Probably it might be mild for 97 patients in out of 100, but at least 3 will end up into serious situation and might die. Let us see that we do not fall in that 3 category. So everyone has a responsibility to save himself. We cannot take it granted that it is a milder form of disease. That is what we need to emphasize and we need to understand.
I think that's up. Then the mortal rate is also very, very insignificant compared with that of the first wave. And second is that so far as the workers, sanitation workers and all others, there is not a single case which was reported where these people have contracted with the coronavirus. So what is the difference? Of course, the doctors and medical professionals, they have all attracted and there are a lot of deaths and casualties. But so far as the municipal health workers and other workers, there was not a single case reported and who are actually exposed to danger of this coronavirus. They have been trying, they're struggling hard with all these things, but not a single people, that's a single worker appear to have been affected. That's what I think. It's subject to correction, of course. So what would be the reason?
Sir, we have not reached the peak yet.
Yes.
So when there is a peak, when there are a huge number of cases, then there will be good number of cases will be turning into serious form. Sir. So we cannot take it granted at any moment. We need to be cautious. Caution is a gold standard thing or word which we need to keep in our mind. We see day in, day out our own doctors. There are house surgeons who are getting positive, they are just staying in isolation. Every day we get so many doctors getting positive. They get treatment, they stay in isolation, and again they come back once they finish their quarantine
Isolation
for
period.
5 days. So I really appreciate those brave hearts who are involved. But as you said, there are the municipal workers or sanitation workers might be less affected, but we see in Gandhi Hospital every day we see some doctors affected. I asked, where is that house surgeon? They say, sir, he came positive for COVID, so he is in isolation. That happens every day. Around 4 to 5 doctors become positive, and then they stay in isolation. Once they are fit, once they finish their quarantine, they come back to serve the patients again. So there are people turning positive for Omicron also. The severity of the disease seems to be less, but definitely precaution should not be ignored. That is the take-home message that we have to keep in our mind.
So another personal query that's up. Maybe shortly in a week or so, my near relatives are coming from Canada, and what is your advice? They are coming for marriage. Are they supposed to be kept in quarantine, and if so, how many days?
So as per
And what would be their impact on us because they are coming from abroad? This is my personal query.
now the entire world is a global village.
Yeah.
Travel from one part of the world to the other for various reasons is inevitable or cannot be avoidable.
Yes.
In such situations, if they are coming, the principles would be let them get tested there. Of course, they
Yes.
will be tested
Yes,
before
tested.
boarding
Yes.
flight. Let them come back when they reach India. Let them get tested again, because the travel time is quite long. They come across various transit places like airports and other places.
Yes. Yes.
So there are chances that they might catch infection somewhere. So when they come, let them be in isolation. Let them get tested. And in case if they are positive, let them be in quarantine for 5 days. Once they turn negative, let them again mingle with other people. This is the precaution which every one of us can take. That is safe for them and safe for all of us.
Thank you.
Raghu Kumar.
Sir, namaste, namaste. Thank you very much for calling me. Practically, sir, doctor gave a wonderful information, and this is different. Definitely, this is a different field for me. So I can only say that I congratulate him for a wonderful session. But I would like to seek certain information on two counts. One is there any study done? Because now we have almost spent about 20 months on with COVID. Is there any analysis available anywhere about the economic groups, like poverty or rich or something like that, and percentage of people affected in those groups? Is there any such analysis anywhere available or anywhere done practically?
Sir,
This is one thing. This is one thing, and the second thing is there any analysis relating to psychological depression causing the deaths in a COVID situation, or something like that? Is there any study in those areas, and is there any statistics available for that in your knowledge?
Yes, sir. As far as medical research is concerned, our ICMR is the highest body which keeps monitoring, which encourages, and which gives all the information, which monitors all the research, and that is the highest body for medical perspectives. And the psychological impact on COVID patients, that is also being studied. There are a good number of papers published by different psychiatrists or psychologists in India, and that is all available online, sir. Psychological impact because of the disease, because of quarantine, age-related psychological impact, and the impact due to isolation and due to lockdowns and all these are available. And there are various indicators, psychological indicators. People have done studies, they have done research. Mainly this is all done by psychologists or psychiatrists. So these papers are available online and we can go through those papers. That is about the psychiatric and the psychological impact of COVID and this research done. As far as economical impact, and that I think socio-economic groups might have done it. I have a small idea that there is some research going on in that perspective as well, but I'm really not very sure about how much work is done and what are the results of all that. But psychological perspectives, which is a part of medical profession, psychiatrists have done good amount of research. The impacts of COVID, isolation, age-related changes, psychological impact of the disease, severe form of disease on individuals, and at the same time, the lockdown, staying at home, that psychological changes and all. These things have already been studied, sir, and these are available for reference online. So probably we can go through those papers and research aspects.
Thank you, sir. Thank you, and thank you, Ramarao garu and Telangana Janavedika. Thank you very much.
Thank you, sir.
Welcome.
Manoj.
Yeah. Sir, good evening, sir. Firstly, my respects to my Guruji Purushottam Rao garu, and thank you, Dr. Khabeer sahab. आप इतना टाइम दे के हमारे को बहुत इंटरेस्ट के साथ, बहुत तजुर्बे के साथ आप एक एक चीज बताए, बहुत बहुत शुक्र अदा गुजारता हूँगी. और दूसरी बात, one more small question from my side, sir. So some eminent doctors like you are saying that it's going to come to an endemic in couple of months like that. Is it true, or we are going to face another variant like fourth wave, fifth wave? तमाशा कितने दिन चलते रहेंगे डॉक्टर साहब? जरा आप बोले तो जरा तसल्ली हो जाती है हमारे को. Thank you.
Sir, I have discussed this perspective because many people keep asking, how long will all this drama go? How long should we be scared of this COVID-19? How many new members of this COVID family will come in future? So few people say it is the invent of latest drugs like molnupiravir, which will bring an end to this. Some people say until and unless 100% effective vaccine comes into the field, till then we cannot be considered as safe from this COVID. So there are different mixed opinions of people. For that very reason, I have included one slide in my presentation about the future perspectives of COVID-19. There is one perspective, as I discussed, that this Omicron, which is very fast in spreading, very somewhat milder in seriousness of the disease, might impart immunity to most of the individuals. Likewise, when all the people get immunized or all the people get immunity against this, then this will not remain a health hazard at all. It will not cause any serious disease, or the death toll would be very less. So that way it will slowly fade off and it will come to an end. This is one opinion. The other perspective is, suppose if we are careless, suppose if we are not taking care to avoid this transmission of this virus, then virus will get many more individuals, many more hosts, and every host is a different for the virus. So it's a different playground for the virus. It will play there. It will acquire different resistant mutations and all. So more the virus spreads, more is the risk of mutation. More is the risk of mutation, more are the variants. And even if out of many variants, if even one fellow proves to be notorious, and if that mutant virus can drive entire wave, as we have seen Delta, huge loss of lives and economic loss in our country. So we need to be cautious. At this stage, we need to be just speculating to be responsible as a citizen. We have to try to cut down transmission, stay safe, and we have to tell each other and make our community aware of all the preventive measures. That is how we can cut down the transmission, we can prevent future mutants, and we can bring an end to this. I really congratulate the organizers of this program. who with their foresight have made it possible chain of transmission and prevent the future mutants and bring an end to this COVID-19 entire episode and entire thing.
Thank you, sir.
Thank you. There's one question in the chat box. I want a clarification on what is the difference between Corona and Omicron.
Sir, Corona is nothing but the parent, and Omicron is the offspring of the virus. So whenever these two belong to the same family of coronavirus, Corona as such is, as I said, all the viruses with spikes which look like a crown are grouped in this Corona family. COVID-19 SARS or severe acute respiratory syndrome virus is one of the member, and this is the predecessor, and followed by that is the novel COVID-19 virus, which came out of mutation. From this COVID-19 virus, there was one more mutation resulted in Delta, the other mutation that resulted in Omicron, and finally IHU, which has resulted in a new variant which has got 46 new variations in the genetic sequence. So these are nothing but the members of same family, but because of the mutations, there are certain differences among these.
James has raised his hand. James, go ahead, please.
Yeah, thank you, sir. Thank you, Dr. Khabeer, for giving us some such valuable information, because we have been more or less being informed that this Omicron is a little milder than the other variants, and so thank you for basically telling us that we have to be vigilant as earlier, and that we have to be very responsible and be very careful with this. Thank you, sir, for giving us a very important presentation. And I have a quick question, sir. Actually, I think I'll have two, and I think I'm trying to phrase this question as I talk to you. Is about the mRNA vaccines, which usually, as we have been hearing about them, that they work on the gene's genetic structure itself. And so going forward, I mean, this thing is going to be there for a while. The virus is going to be there for a while. And so what would be and they're saying that mRNA vaccines would be the best possible way out, best vaccines for this. So how do you compare them with the other vaccines which have come? Because they also seem to have been working quite well. Covaxin and other vaccines which are also been working quite well. Could you throw some light on this area?
Basically, vaccines are nothing but the medicines or injections which are prepared, artificially manufactured. They are basically to go stimulate the immune system of individual, so that the immune response mounted against the virus in case of any active infection, similar resistance or the immune response would be elicited by these vaccines. So that will keep the immune system and the individual ready to fight against any impending or any untoward infection. Suppose if the person gets infected, his immune system will be already primed, prepared well, and stimulated to fight against the disease. This is the main aim of vaccine. So vaccines are again prepared keeping in mind the way the virus behaves. For example,
Mhm.
there are certain vaccines which are prepared based on the principle of the spike protein. Spike protein is one which helps virus to stick to human cells. Once the spike protein helps to stick to human cell, then the virus will stay there. It will establish itself, and finally, once it is established, will cause the disease. So, some vaccines are prepared keeping in mind this part. What they do, they take this spike protein resembles the spike protein of chimpanzees. So they make use of that virus. They prepare a vaccine, and this route of prevention or imparting immunity is one channel. The other things are like there are certain vaccines which use killed COVID virus. They kill the virus, and then they are sure that this killed virus will not cause serious form of the disease at all, but it will equally go and stimulate the immune system of the individual, so thereby giving him immunity. So that is the other channel or other pathway by which the vaccine works. And similarly, mRNA is again a different way how the vaccine works. Whenever a virus enters into the body, it sticks with the spike protein, then it establishes itself, and then it will go, all the genetic material of the virus will go and gets assimilated with the genetic material of the human cell. From there, the virus genetic material keeps dominating. It will then produce certain mRNA. mRNA is nothing but the messenger RNA. Messenger RNA will go and then cause production of cytokines and inflammatory mediators and other things which are very damaging to the individual. And in case if mRNA and copies of this viral DNA is that production goes on in huge number, then the count of virus goes on increasing in the body of an individual, and thereby if the viremia or the viral count increases, then the seriousness of the disease will increase. So this point is made use in manufacturing or preparing mRNA vaccines. What they do is they make use of this vaccine, and directly this mRNA is prepared by the human individual. But this has got certain difference. This is not the same as that of the live virus, but it would be not causing disease, but at the same time will do the work of stimulating or preparing immune system of the individual to prepare immunity, keep himself ready. So these are the different mechanisms with which these viral vaccines work. So we cannot say that one is superior to the other. Everyone has its own importance and everyone works in their own way. And in the present scenario, it is said that the mRNA mediated vaccines are very effective. They have least side effects, but at the same time, other vaccines are also doing good job. So any vaccine, whichever we get is equally good, we can go for vaccination without as such discriminating or trying to avoid ourselves from vaccination.
Thank you,
Thank
Doctor.
you.
Super
In
wonderful
December,
explanation.
Thank you.
I have one more quick question. I have one more quick question. I have one more quick question. I have we have received a message from the government that above 60 age, above years of old, can receive the third dose, and people have. I'm in AP, sir, and people have been saying that you should get cross-vaccinated. That means that they got received co-vaccine earlier, so they should receive Covishield. So, what would be your thoughts on this, sir?
Sir, actually,
And also one more thing.
yes,
One more thing is that there have been reports in the media that Covaxin will be coming with a booster shot in about a couple of months. Should we wait for that, or should we just go for the third dose for my parents, and then when it comes, we can also go for it? So please clarify on
Sir,
this.
there are different parts of your question, as I understand, sir. One question is like any senior citizen, they are given preference, they are told to take a booster. That is very true. So the reason is elderly individuals have weaker immunity. They have other diabetes, hypertension, cardiac ailments, which would make them further weak. So to protect them, government gives preference to those senior citizens. Are given preference and they are given vaccination. Second part is like, should we go for same vaccine which we have previously taken as a booster, or should we go for a different one? So there are different studies in this regard, sir. Actually, what happened is, I think it's most likely in West Bengal or some state where initially some people received Covishield, and because of non-availability or shortage for some reason, second dose they have taken Covaxin. Then there was a study done on that group of people who have taken different vaccines as first and second dose, and it was found that the immunity that they developed out of age was much higher than those people who have taken only Covishield as two doses, and more than those people who have taken Covaxin as 2 doses. So then came the concept of cocktail of vaccines, cocktail vaccination. There are many papers published. Then that caught some interest from the international groups. They have also started giving cross vaccinations and found that there is some advantage over same vaccine. Ultimately, of course, with such a huge population in India, with such a huge demand, whatever vaccine we get, it is better we get vaccinated. Anything definitely keep us better off than the people are not vaccinated. So if we have an option, then we can select. And in case if we don't have an option, then at least go with whatever is available and be safe, protected than those people who are unprotected, who are not vaccinated. This is the thing.
Thank you, Dev. Thank you.
Thank you.
సార్ అందరికి నమస్కారం. జనవేదిక రాము గారికి, ఆర్గనైజర్స్ అందరికీ ధన్యవాదాలు. ఇట్లాంటి సిచ్యువేషన్ లో రియల్ టైం డాక్టర్, ఎక్స్పీరియన్స్ డాక్టర్ తోటి లెక్చర్ పెట్టించినందుకు మా అందరికి ఉపయోగపడుతుంది. థ్యాంక్ యూ వన్ అండ్ ఆల్. డాక్టర్ కబీర్ సార్.
Thank you, sir.
Bashiruddin. Bashiruddin, please unmute yourself and go ahead with your question. Please unmute yourself, Bashir.
हेलो सर, गुड इवनिंग सर.
Good evening.
डॉक्टर साहब से मेरा सवाल ये है कि बच्चों पे इसके क्या असरात हो सकते हैं, सब इफेक्ट्स बच्चों पे बिलो 14 इयर्स जो चिल्ड्रंस है ना,
Yes, sir.
वो उसके लिए हम क्या प्रिकॉशंस लेना, बच्चों को कैसा जो है एहतियात करना?
Sir, this was the question which was asked by a participant earlier, and I have just answered. But anyhow, what would be the effect of COVID infection in children? So far, it is expected out of the research or out of the knowledge that we have about COVID, out of the understanding that we have developed over 2 years, that the COVID infection in children would be somewhat severe compared to elder individuals. For the reasons obvious or reasons known, children are more fragile. Their immune system is weaker compared to elderly individuals. So any small infection can get serious because of their weaker immune system. Likewise, COVID, which is known to cause a serious form of the disease, might affect children much more in a much more serious way than the adult individuals. One thing. Secondly, children they get hypoxic or their saturations fall very quickly. Their compensatory mechanisms are bit poor. In elderly individuals, they can tolerate fall of saturation to some extent, but children can't. So even a small fall in saturation can bring a lot of damage to the vital organs in children. So we need to be very cautious. So these are some of the things which are really different from adults in children. This would be the impact of virus in elderly and as well as children. What measures should we take? We have to keep them doubly protected. We have to keep them at home. That is why the online system of education is again brought into force. And we have to avoid taking children out. We have to avoid taking children to crowded places, closed cabinets and all. Try to keep them healthy, keep their immunity system strong by giving them fresh fruits, vegetables, good nutrition, hydration, good rest. And at the same time, there are certain medications which are said to be like antioxidants, multivitamin, zinc, vitamin C. And there are certain Ayurvedic formulae as well, which are said to boost immunity of an individual. So those things can as well be tried. So that way we have to strengthen the immune system of our children and keep them very strong to fight in any untoward situation. That is how we can do.
Thank you, Dr. Sir.
Welcome, sir.
Doctor, this is a purely an academic interest. You have actually said racial differences and all those things. When we talk about superstitions, a lot of people think that this vaccination, especially vegetarianism and vegans and all these things. When we talk about vegans, what I was reading yesterday or day before yesterday, tennis player Djokovic has not taken the vaccine because he's a vegan. So how do we differentiate between a non-vegetarian, a vegetarian, and the vaccination? And if a non-vaccinated person, if he is going freely, and what would be the impact he will create in the society?
Sir, first of all, the thing is, I think basically this needs a thorough study between a vegetarian group and a non-vegetarian group. How much they are strong enough to fight infection in case if they get infected. There are, to my knowledge, no studies based on the nature of the food intake or the vegetarian and non-vegetarian. And suppose if that is a point, probably we need to study. We have to categorize people into two groups, vegetarians and non-vegetarians, vaccinate them and check for the effects, and some of them have to be kept unvaccinated, and we have to study how their response is, whether they are strong enough, whether they require vaccine or not. This definitely needs to be probed, sir. And suppose if we are talking anything now in this session or elsewhere, we should always talk in an evidence-based manner. So without any study, probably it would only be an assumption. It would just be a random idea, and that might be true or might not be true. So we cannot make it generalized, sir. If it is his opinion, that might be his personal opinion. We respect his opinion, might be. But at the same time, this cannot be generalized so long as we have a thorough scientific study. We have some analysis, still we have some evidence to say that. Probably then we can generalize. So that needs to be probed, that needs to be studied, sir.
But see, when we are talking, this is a pandemic. There's no question of individual opinion here, isn't it?
Yes, sir. Actually, there are a good number of people who still are not vaccinated in our community. They have their strong ideas and they don't change it. For such people, I would just say they have to think over and they have to analyze the situation. They need to be more responsible. See, if this unvaccinated group is big enough, then those people are sufficient to provide a chance for the virus to get mutated once again. So basically, it is the individual responsibility first to protect himself. Everyone is responsible for his own protection. Basically, first at level 1. At level 2, he should be socially responsible. He should be responsible to keep the society safe. First is the individual society safety. Second is the safety of the society. So there are two responsibilities: responsibility to keep himself safe and social responsibility to keep other individuals safe. Suppose if some person is not serious about these responsibilities, then probably some or the other way he might get affected, he might get into serious condition. At the same time, he might be a tool or a source for the spread of infection. So in one or the other way, that might affect his health and other people as well. So we need to be cautious.
Thank you. Thank you, sir. Thank you. Anybody, any questions, please? Please raise your hand. Doctor was very kind enough. He has given a lot of time on a Sunday, family day. Will not get a chance to again. Srinivas, man aduguta Kottapelli. Yeah. Sinu adugu. Sinu adugu.
డాక్టర్ గారు నమస్కారం సార్.
నమస్కారం సార్.
ముఖ్యమైన టైం చేయడం చాలా విషయాలు చెప్పారు. ఇప్పుడు ఈ కరోనా టైంలో రెగ్యులర్ గా మన నిత్యావసర వస్తువులు కానీ ఎక్కడైనా కూర్చోవడం కరోనా టైంలో రెగ్యులర్ గా మనము నిత్యావసర వస్తువులు కానీ సెల్ ఫోన్ కానీ షేక్ హ్యాండ్ ఇవ్వడం ఇలాంటివి చేస్తే కరోనా తగ్గే అవకాశాలు ఎక్కువ ఉన్నాయని చెప్పారు. కానీ ఇప్పుడున్న పరిస్థితుల్లో తప్పనిసరి వస్తువులు తెచ్చుకోవడం అవి జరుగుతుంది. దానివల్ల ప్రబలే అవకాశం ఉంది.
Sorry, sir, because of the break in voice.
No, what he's saying is, if we go into the fair price shops for getting our groceries or carrying the telephone, cell phones and all this, will this pandemic infectious? Will it carry?
Sir, the thing is, so one of the mode of infection spread is the somites. Suppose if we are dealing with the patient, treating the patient, suppose someone is at home in isolation who is affected with COVID or corona, then the whatever his bed sheet or pillow or whatever his clothing, the things which he uses will definitely get soiled with the saliva or respiratory secretion or whatever. So those come into the category of fomites. So that is one way or the mode of spread of infection. So we need to be cautious when we are dealing with the patient or someone at home in isolation, or if we are a healthcare professional, then we have to be cautious with that. As far as grocery is concerned, or vegetables are concerned, or fruits are concerned, we are not directly dealing with the patients there, but there is small risk of that getting infected and we are carrying infection to home. In such situation, what we need to do is we need to thoroughly clean vegetables, fruits, or with whatever best way possible. The way we are washing our hands, that is the same way we have to wash these things so that we clear off any fomites or any material on. So that way we can avoid spread of infections. We have to be cautious, but at the same time not to be scared, Don't think that everything we are getting is infective material. We are not dealing with the patients there. But one small word of caution that I would like to say is we have a habit of going into supermarkets. Most of the supermarkets are air conditioned closed cabinets. At times they get overcrowded. Rather, I prefer to go a grocery shop which is open. I try to get it over counter, whatever I want. And it will not be a closed cabinet. The rate of infection spread is lesser in such situations rather than in supermarkets which are closed. So that atmosphere is likely to get infected more than this open grocery shops. And so that way probably we can prevent. That is how we can do.
Thank you. Any more questions? Last two questions I'll allow. अतर हुसैन, आपको कुछ पूछना है क्या? Hello. Yeah.
Good evening, everyone, sir.
Good evening.
Good evening, sir.
Assalamu alaikum. खैरियत से हैं?
वालेकुम अस्सलाम, अल्हम्दुलिल्लाह।
मैं अतर हुसैन बोल रहा हूँ सुबेदारी से।
जी सर।
बहुत बहुत खुशी हुई आपका प्रोग्राम सुना। एक्चुअली सर डॉक्टर साहब वरंगल के ही हैं, तो मेरे आपके वालिद साहब मेरे बड़े बुजुर्ग हैं।
अच्छा, वरंगल के है क्या डॉक्टर साहब? दिस इज न्यूज़ टू मी। Okay, very nice.
Actually, he worked at Kottagudam Pakal. इसलिए वो आप चांस दिए बोल के बात कर रहा हूँ मैं। और आपके वालिद साहब जो है, आपके फादर जो है मेडिकल कॉलेज में साइकोलॉजी पढ़ाते हैं।
अच्छा।
और आपके घर में आप डॉक्टर है, चारों डॉक्टर है आपके घर में।
Very nice, very nice. Well, thank you for that update. It's a small world.
और आपके ब्रदर इन लॉ जो है चीफ इंजीनियर थे यहाँ एनपीडीसीएल में।
ओह,
यूनुस साहब। एक एजुकेटेड फैमिली है और आपके वालिद साहब से मेरे अच्छे ताल्लुकात हैं। और ये एक्चुअली ये डीमार्ट रॉयल फंक्शनल के बाद से गली में यहीं घर था आपका।
ओके ओके ओके
ओके, थैंक यू सर।
थैंक यू
थैंक यू
Thank you for kind words, sir.
Any questions, please? Any more questions? One question. We have 2 minutes time. One question. One more question. I think your son also was treated by Dr. Saul, who was one of the first patients affected by COVID.
You are in mute.
Anjan Rao garu. Hello. Okay. Thank you so much, Doctor. Srinivasu garu, will you please end this session now?
Thank you. Telangana Janavedika.
Hello, one second. Uma was also a patient for some time. I think you will also have some questions.
Hello, Anna, thank you very much, Anna. Hello.
Yeah. Uma, go ahead.
There were very good, sir. And these Omicron cases. Thank you very much, sir. Thank you.
Thank you, Umameshwar. Thank you. తెలంగాణ వేదిక జూమ్ ఆన్లైన్ మీటింగ్ వచ్చేసి కోవిడ్ మూడో దశ భ్రమలు వాస్తవాలు అనేటువంటి అంశం పైన కబీర్ అహ్మద్ గారు వారి ఫీల్డ్లోకి ఓపెన్ అదేవిధంగా
ప్రొఫెసర్ నరేంద్ర కుమార్ కూడా వచ్చిండు ఢిల్లీ నుంచి.
తెలియజేసుకుంటూ మరొకసారి అందరికీ